Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
Hey everyone, and welcome. Have you ever wondered, how do doctors really know if that scary chest pain is a full-blown, life-threatening heart attack? Well, it all comes down to these tiny, invisible signals our body sends out in a crisis. Today, we're going to dive into the world of cardiac biomarkers.
Okay, so picture this. You're in the emergency room. Your chest is tight, your heart's just hammering away. The one question, the only question that matters right then for everyone, especially the doctors, is this a heart attack? And if it is, how bad are we talking?
And in that situation, the clock is just ticking, ticking, ticking. I mean, every single moment that passes could mean more damage to the heart muscle. So doctors can't afford to just guess. They need clear, solid proof to make the right call and start that life-saving treatment immediately.
So how do they get that proof? Well, they listen for the body's own little distress signals. We call these cardiac biomarkers. You can think of them like tiny little messengers that only get released into the blood when the heart muscle is really in trouble. They're the smoking gun, the definitive proof that doctors are looking for.
And this right here, this shows you exactly what's going on, but on a microscopic level. See, a normal, healthy heart cell keeps all its stuff neatly packed inside, but during a heart attack, those cell walls start to break down, and all the proteins inside, yep, those are our biomarkers, they just spill out into the bloodstream. That's exactly what a blood test is looking for.
All right, so here's what we're going to cover. First up, we'll meet the original detective on the scene, creatine kinase. Then we'll get to the modern gold standard, troponin. We'll also see how it's not just one marker, but a whole team. And finally, we'll break down how doctors actually read these vital clues to solve the case.
Okay, let's kick things off with a real pioneer in this field, creatine kinase, or CK for short. For a long time, this was the main tool in any ER doctor's toolkit.
Now, doctors zero in on a specific type of this enzyme called CKMB. And it's super useful because it shows up in the blood pretty fast, usually within about 3 to 6 hours after a heart attack. But there's a catch. While it's mostly in the heart, you can also find small amounts in other muscles. So, a really bad muscle injury somewhere else in the body could, in theory, throw off the results and give you a false positive.
Take a look at this graph. It shows you the timeline for CK. See that sharp red curve? It shoots up fast. It's its peak at around 24 hours, and then, poof, it's gone almost as quickly as it came. That fast rise is great for catching things early, but because it disappears so fast, it means doctors have a pretty small window to actually catch it.
So, that issue with specificity plus that short timeline, it really pushed researchers to find a better, more reliable marker. And you know what? They found it. So let's talk about the current champion in the world of cardiac diagnostics, troponin.
Okay, the absolute game changer with troponins, and we're talking specifically about cardiac troponin T and troponin I, is that they are almost only found in heart muscle. That's it. So when a blood test picks them up, there's really no doubt where they came from. This incredible specificity totally revolutionized how heart attacks are diagnosed.
All right, let's put them head to head. The rise time is pretty similar, a few hours. But check out the other two rows. Specificity? CKMB is good, but troponin is excellent. It's the gold standard. And then, how long does it stick around? CKMB is gone in maybe 3 days. Troponin? It can stay detectable for up to 1 or even 2 weeks. That's huge.
And if we go back to our graph, you can see that difference plain as day. Look at that blue troponin line. It goes up, and it just stays up. This massive timeline is just incredibly valuable. It means a doctor can diagnose a heart attack not just in the first few hours, but potentially days after it actually happened.
But, it's not really a competition like CK versus troponin. The reality is, doctors look at a whole panel of different clues. It's all about building a complete picture. And for that, you need a team of markers.
So here are a few of the key players on that team. Look at myoglobin right at the top. It's the speedster. It can show up in as little as an hour, but it's not very specific to the heart, and it's gone within 24 hours. So you can really start to see how each of these markers brings a different piece to the puzzle, right? They all cover different time frames. And it's not just about heart attacks either. There are other biomarkers for different heart conditions. For instance, there's one called BMP. If levels of that are high, it's a really strong clue that a patient might have heart failure.
That helps doctors figure out if shortness of breath is from the heart or something else, like the lungs.
Okay, so we've got this whole team of markers. How on earth do doctors put all this data together in a super high-pressure ER situation to actually make a diagnosis?
Well, the key, and this comes straight from our source material, is something called serial testing. It's not about taking one single snapshot. It's all about looking at the trend over time.
So here's how that usually plays out. A patient comes in. They get an initial blood test done right away. Then, and this is the critical part, they take another sample a few hours later, maybe around the 6-hour mark. And what the doctors do is compare those two results. They're asking one simple question: are the levels rising?
And this is the most important takeaway. A single high number could mean a few different things. But a rising pattern, seeing those specific heart markers climb over a few hours, that is the absolute unmistakable signature of a heart attack. It's the trend, not the single data point, that tells the real story.
So let's bring it all the way back to our patient in the ER. With all this amazing science, what does it all mean for them?
Honestly, it means everything. It means doctors can go from just a suspicion to a certain diagnosis, and they can do it fast. That lets them start the exact right treatments immediately, like going in to clear a blocked artery and save precious heart muscle. It also helps them figure out just how bad the attack was and gives them a good idea of the patient's prognosis. This isn't just numbers on a chart, it's literally a roadmap to recovery.
So these tiny little proteins, they're like these incredibly reliable detectives for our heart. They give us this crystal clear window into the health of our most vital organ. And it really makes you wonder, right? As science keeps pushing forward, what other subtle clues, what other distress signals from our own bodies are we going to learn how to read next?